set of cells in the lung, in green 488, and secretoglobin, which marks club cells in the airways, and that's in Cy5. So you guys can have a look. I think I've already set it up. Yeah. You can just have a look how the signal looks. So this is the 488 channel. So you can see puncta for SPC in a few cells. Yeah. That's typically how it would look. We don't have a Cy5 one, so we'll just image Cy5 here. Okay. All right. Oh, before I go ahead, so this one is on a cover slip. The reason I did it on a cover slip was I was doing like multiple in situs, like I was doing 5 in situs and then adding DAPI later. So what you would usually do is you would take normal cover slips. The protocol is there, so you would coat it with polylysine, dry it, then collect sections on these cover slips and do your in situs. Just be a little careful because these are like super delicate and they tend to crack. And once you're done with your in situ, you don't remove the sealed chambers. You would just keep them there and you can directly use it for imaging. And once you're done with your first round of imaging, if you want to add any other reagent or DAPI, you can directly add it through the ports. Yeah. Okay, so not seeing anything. Okay, so this is a lung slice of an adult mouse lung. This is an airway. It typically looks like this. These are just the alveolar regions. So what you see in green is signal for SPC transcript. So this transcript is enriched in a subset of the alveolar cells, which are 82 cells. So you can see like these cells light up. And what you see in red is a transcript that marks club cells in the airways. And you can also see they also are known to have like sparse puncta or like low levels of expression in the alveolus, but most of the expression is enriched in the airways. And Tushar mentioned about this in the morning. So this is the airway and this is the alveolar epithelium. At the junction of the airway and the alveolar epithelium are bronchoalveolar stem cells or BASCs. So these usually have both SPC transcripts and secretoglobin transcript. So if you can actually see it, like, so you can see like these guys. I can zoom in. So they have like both signal for red and green. So it's like there are a few BASCs here. There's one here, one here. Yeah. So here you're not seeing, these genes are expressed in very high levels. So you're not seeing individual puncta. There are some, I guess, which you can see here, but this is not something that's like normal for every gene you would look at. So if your gene was like moderate or rare, then in those cases you would start seeing like individual puncta. So that's typically how it looks. It looks very similar to how your immunostaining would look if it's like super abundant. Yeah. So do you have like any questions now? Okay. We can head back to Beckman.